Hello and good morning. Today I'm going to explain the main symptoms about the disorders of the respiratory system that affect our organisms. The first is pneumonia. Pneumonia, obstruction of bronchioles, the low gas exchange and high exudate. The main symptoms are productive cough with yellow blood streak, rusty sputum, fever, chills, tachycardia, tachypnea, dyspnea, pleural pain, malaise, respiratory distress, and low breath sounds. The next one is tuberculosis, or the next name is TB. The main symptoms are negative with chronic cough. It's productive cough, but it's chronic in this case. Progressive fatigue, malaise, anorexia, weight loss, hemoptysis in advanced state, clarity, chest pain, and in the late afternoon, presents low-grade temperature. The next one is influenza or flu. The main symptoms are chills, fever and heat aches and muscular aches, malaise and weakness. The next is the COVID-19. The common symptoms are fever, dry cough, and flu-like symptoms. Several cases are dyspnea, chest pain, hemoptysis, crackles, and respiratory insufficiency. The next one, there are chronic bronchitis. There are clinical diagnoses, daily productive cough for 3 months or more in at least 2 consecutive years. The main symptoms in this case, there are overweight and cyanotic, elevated hemoglobin, peripheral edema, and in the auscultation, it's rhonchi and wheezing. The next one is emphysema. Emphysema is a pathologic diagnosis, frequent enlargement and destruction of airspace distal to the terminal bronchiole. The main symptoms are older onset, severe dyspnea, and quiet. The next one is the COPD. COPD is chronic obstruction pulmonary disease, and it's a chronic airflow limitation about emphysema and chronic bronchitis. In this case, the main symptoms is easily fatigue, frequent respiratory infections, and use of accessory muscles to breathe. There are muscle scalenus, sternocleidomastoid muscle, and intercostal muscles. Other symptom is orthopneic. Another symptom is cor pulmonale late in disease. The next is the chin and appearance, wheezing, poor sleep breathing, chronic chest, dyspnea, barrel chest, and prolonged respiratory term. Bronchitis increased sputum. And the last is digital clubbing, or nail clubbing is a deformity of the finger or two nails associated with a number of diseases, mostly of the heart and lungs, which cause chronically low blood levels of oxygen. The next one is asthma. This reactive airway disease. There are triggers, hypersensibility, EURI, these upper respiratory infections, exercise, air pollutants, respiratory infections, and GERD. GERD is gastroesophageal reflux diseases. The characteristics of hypoxemia in this case is tachycardia, high restlessness, and tachypnea. Another symptoms is cough, high mucus, shortness of breath, wheezing and prolonged expiration, high CO2 retention, retractions, and chest tightness. The next one is acquired respiratory distress syndrome. The signs and symptoms they are tachypnea, dyspnea, retractions, tachycardia, hypoxia, and low pulmonary complaints. And low PaO2 and high dyspnea. Another case is in the pleural disorders. The main symptom is pain and cause rapid shallow breathing. In this case, accumulation of substance between layers of pleura lead to of the condition. In this case, there are pneumothorax, emphysema, hemothorax, and hydrothorax. The last one, and finally, the lung cancer, the main symptoms are cough, sputum, hemoptysis, goes low endurance, chest pain, and the diagnosis can be by cytologic sputum test time, thoracosynthesis, X-ray, and thoracoscopy. And there, these are the disorders of the respiratory system.